Section 4, page 70. SNP, Special Needs Plan, SNP. An SNP provides benefits and services to people with specific diseases, certain healthcare needs, or who also have Medicaid coverage. SNPs tailor their benefits, provider choices, and list of drugs, formularies, to best meet the specific needs of the groups they serve. Can I get my health care from any doctor, other healthcare provider, or hospital? Some SNPs cover services out of network and some don't. Check with the plan to see if they cover services out of network, and if so, how it affects your cost. Do these plans cover prescription drugs? Yes. All SNPs must provide Medicare drug coverage Part D. Do I need to choose a primary care doctor? Some SNPs require primary care doctors and some don't. Check with the plan to see if you need to choose a primary care doctor. Do I have to get a referral to see a specialist? Some SNPs require referrals and some don't. Certain services like yearly screening mammograms don't require a referral. Check with a plan to see if you need a referral. What else do I need to know about this type of plan? These groups are eligible to enroll in an SNP plan. People who live in a certain institutions like nursing homes, or who live in the community but require nursing care at home, also called an institutional SNP or ISNP. People who are eligible for both Medicare and Medicaid, also called a dual eligible SNP or DSNP. DSNPs contract with your state Medicaid program to help coordinate your Medicare and Medicaid benefits. People who have specific severe or disabling chronic conditions like diabetes, end-stage renal disease, HIV/AIDS, chronic heart failure, or dementia, also called a chronic condition SNP or CSNP, plans may further limit membership to a single chronic condition or a group of related chronic conditions. An SNP provides benefits targeted to its members' special needs, including care coordination services. To find and compare Medicare Advantage plans, visit medicare.gov/plan compare. Select Special Needs Plans to see if a SNP is available in your area. If you need more information, check with the plan. Page 71. You can join, switch, drop, or make changes to your Medicare Advantage plan. Initial enrollment period, see page 17. When you first become eligible for Medicare. When you first become eligible for Medicare, you can join a Medicare Advantage plan. If you joined a Medicare Advantage plan during your initial enrollment period, you can switch to another Medicare Advantage plan, with or without drug coverage, or go back to original Medicare, with or without a separate Medicare drug plan, within the first 3 months you have Medicare. General enrollment period, see page 18. January 1st to March 31st. If you have Part A coverage and you get Part B for the first time during this period, you can also join a Medicare Advantage plan. New. Beginning January 1st, 2023, your coverage starts the first day of the month after you sign up. Remember, you must have both Part A and Part B to join a Medicare Advantage plan. Open enrollment period, October 15th to December 7th. You can join, switch, or drop a Medicare Advantage plan during the open enrollment period each year. Your coverage starts on January 1st as long as the plan gets your request by December 7th. If you join a Medicare Advantage plan during this period but change your mind, you can switch back to original Medicare or change to a different Medicare Advantage plan, depending on which coverage works better for you. During the Medicare Advantage open enrollment period, January 1st through March 31st. Medicare Advantage open enrollment period, January 1st through March 31st. Note, you can only switch plans once during this period. If you're in a Medicare Advantage plan with or without drug coverage during this period, you can switch to another Medicare Advantage plan with or without drug coverage, drop your Medicare Advantage plan and return to original Medicare. You'll also be able to join a separate Medicare drug plan. During this period, you cannot switch from original Medicare to a Medicare Advantage plan. Join a separate Medicare drug plan if you have original Medicare. Switch from one Medicare drug plan to another if you have original Medicare. You can only make one change during this period, and any changes you make will be effective the first of the month after the plan gets your request. If you're returning to original Medicare and joining a separate Medicare drug plan, you don't need to contact your Medicare Advantage plan to disenroll. The disenrollment will happen automatically when you join the drug plan. Special enrollment period, qualifying life event. In most cases, if you join a Medicare Advantage plan, you must keep it for the calendar year starting the date your coverage begins. However, in certain situations, like if you move or you lose other insurance coverage, you may be able to join, switch, or drop a Medicare Advantage plan during a special enrollment period. 5-star special enrollment period, December 8th through November 30th the following year. Note, you can only switch plans once during this period. Medicare uses ratings from 1 to 5 stars to help you compare plans based on quality and performance. If a Medicare Advantage plan, Medicare drug plan, or Medicare cost plan with a 5-star quality rating is available in your area, you can use the 5-star special enrollment period to switch from your current Medicare plan to a Medicare plan with a 5-star quality rating. Visit Medicare.gov for more information. Page 73. Important. If you drop your Medicare Supplement Insurance, Medigap, policy to join a Medicare Advantage plan, you may not get the same policy back. Rules vary by state and your situation. Also, if you don't drop your Medicare Advantage plan and return to original Medicare within 12 months of joining, you may be limited in your ability to get a Medigap policy when you return to original Medicare. See page 78. Always remember the materials your plan sends you, like the annual notice of change and evidence of coverage, and make sure your plan will still meet your needs for the following year. You can also visit medicare.gov/plan compare to compare other available options with your current plan. Does Medicare offer other types of plans or programs to get health coverage? Yes. Some other plans and programs may be offered in your area. Some provide both hospital Part A and medical Part B coverage, while others provide only Part B coverage. Some also provide Medicare drug coverage. They have some, but not all, of the same rules as Medicare Advantage plans. However, each has special rules and exceptions, so you should contact any plans you're interested in to get more details. Cost plans. Cost plans are a type of Medicare health plan available in certain limited areas of the country. In general, you can join even if you only have Part B. If you have Part A and Part B and go to a non-network provider, Original Medicare covers the services. You'll pay the Part A and Part B coinsurance and deductibles. You can join anytime the cost plan is accepting new members. You can leave anytime and return to Original Medicare. You can join a separate Medicare drug plan, or you can get Medicare drug coverage Part D from the cost plan if offered. You can choose to get a separate Medicare drug plan even if the cost plan offers Medicare drug coverage. Note, you can only add or drop drug coverage at certain times. See page 80 to 81. To see if there are cost plans in your area, visit medicare.gov/plan compare. You can contact the plan you're interested in for more information. Your State Health Insurance Assistance Program, SHIP, can also help you. See the back cover for the phone number of your local SHIP. A trusted agent or broker may also be able to help. Page 74. Program of All-Inclusive Care for the Elderly. It's called PACE. PACE. PACE is a Medicare and Medicaid program offered in many states that allows people who otherwise need a nursing home level of care to remain in the community, like a home, apartment, or other appropriate setting. To qualify for PACE, you must meet these conditions. You're 55 or older. You live in the service area of a PACE organization. You're certified by your state as needing a nursing home level of care. At the time you join, you're able to live safely in the community with the help of PACE services. PACE covers all Medicare and Medicaid covered care and services, and other services that the PACE team of healthcare professionals decides are necessary to improve and maintain your health. This includes drugs as well as any other medically necessary care like doctor or healthcare provider visits, transportation, home care, hospital visits, and even nursing home stays when necessary. If you have Medicaid, you won't have to pay a monthly premium for the long-term care portion of the PACE benefit. If you have Medicare but not Medicaid, you'll be charged a monthly premium to cover the long-term care portion of the PACE benefit and a premium for Medicare drug coverage Part D. However, in PACE, there's never a deductible or co-payment for any drug, service, or care approved by the PACE team of healthcare professionals. Visit medicare.gov/PACE to see if there's a PACE organization that serves your community. Medicare Innovation Projects. Medicare develops innovative models, demonstrations, and pilot projects to test and measure the effect of potential changes in Medicare. These projects help to find new ways to improve healthcare quality and reduce costs, and sometimes offer you extra benefits and services. Usually, they operate only for a limited time and for a specific group of people, and or are offered only in specific areas. Examples of current models, demonstrations, and pilot projects include innovations in primary care, care related to specific procedures like hip and knee replacements, cancer care, skilled nursing facility or rehabilitation care, and care for people with end-stage renal disease, ESRD. Ask your doctor if they participate in these models and what it means for your care. To learn more about the current Medicare models, demonstrations, and pilot projects, call 1-800-MEDICARE, which is 1-800-633-4227. TTY users can call 1-877-486-2048.